Okay, I think I'm recording. Did you see anything happen in the chat? Okay, great. Awesome. All right, thanks everyone. Welcome to the January 2026 lab meeting. We're excited to start off the new year. Thank you again for your flexibility with the link. I think Zoom is doing a lot of fun things with VCU, so getting a little acclimated with that. So here's some of our new published manuscripts. We have the integration of substance use interventions into reproductive health care. We also have inpatient buprenorphine initiation for treatment of opioid use disorder in pregnancy and postpartum. Some of our manuscripts in review, we have beyond once daily dosing, which is a concordance between patient and provider reports of buprenorphine dosing frequency for opioid use disorder. We also have digital cognitive behavioral therapy, reduces heavy drinking amongst a non-treatment sample of people with alcohol use disorder, a feasibility trial with CBT4, CBT. We also have student voices on research training, a mixed method study on the research education needs of medical students. Just to get acquainted again with our social media, we do have a X, formerly Twitter. We also have a YouTube channel, which we put our recorded Ivy Lab meetings. So if you do miss one, they will be on our YouTube channel. We have our LinkedIn, our Instagram, and here's our lab leads. We have Arjun, Dr. Madison Marcus, Amber, James, another Michelle, Dr. Austin Jones, Nicole Boss, and myself. So one of our projects that we're working on, one of our recent studies, is Project SORT, which investigates the relationship between sleep and opioid use disorder recovery. And below, we have some of our lab members. Our next study is the registry study, which tracks clinical outcomes of pregnant and postpartum patients who seek addiction treatment with our OB Motivate clinic. And here's some of our other lab members working on this study. We also have the CBTIO study, which is adapting cognitive behavioral therapy for insomnia, specifically for people with opioid use disorder. This is active recruitment. Here's our current lab members. We also have active recruitment for another study, the Luberexant 2.0, which is a medication treatment study testing the effects of Luberexant on insomnia and impulsivity among people with opioid use disorder. We also have Suvorexant, which is a phase 3 double-blind randomized controlled trial of Suvorexant versus placebo on insomnia among people with opioid use disorder. This study is actually still in the planning phase. And this is also our lab members working on this study. We also have Project Castle, which is developing a computerized intervention that educates pre-medical professionals on substance use disorder and stigma. And here's our lab members working on this study and our lab leads. And one of our educational studies is the clinical research curriculum study. Our summer curriculum actually just finished their VASAM abstracts in November, and we're working with our 2026 fellows. We also have the First Steps Project, which was previously the Jeffers Project, which addresses maternal morbidity and mortality by adapting a patient navigation model for birthing people with substance use disorder. And here's our lab members working on this project. We'll discuss this a little bit more during our special presentation today. Just wanted to do a lab spotlight. Congratulations to our lab member, Arjun, for being featured in VCU's pre-health publication for his work with the Ivy Lab this fall. And here's an excerpt of that publication. Just wanted to give you an update. Our February 2026 lab meeting will be updated, and I'll receive a email update about that. And that will be in the next coming weeks. Thank you again for your time today. Of course, if you have any questions, please feel free to reach out to me, and my email is in red. And now I'll hand it over to Nicole for an evaluation of the First Steps partnership. Any other questions before I hand it over to Nicole?
Thanks, Michelle. It's exciting. We have a lot of things going on. Nicole, before you start, just make sure you give a little intro about who you are and all of that, and a little bit of, I know you'll put background about the project.
Yeah, I'll probably have to talk fast because I'm not super short-winded, but I will try. Let me see if I can share my screen. Hold on. Okay. Can you guys see that?
Yes.
Okay. Um, I'm Nicole. I am a clinical psychology PhD student at VCU. I'm in the Ivy Lab. I'm also in Bramson Recovery. Hi, Tom. I see you, even though you're like not on my screen right now. And today, the title of my presentation is Evaluating First Steps Partnership. I also want to say thank you to James, Arjun, Amber, and Dr. Martin. I did not give them enough time to look over this presentation, so I don't want to call them co-authors because they have not signed off on this, but they have certainly helped at every step of the way. So, to begin this study, First Steps, it's funded by the Jeffress Trust Awards Program in Research Advancing Health Equity, and we do not have any conflicts of interest to disclose. To preface the agenda, I want to say that usually in research talks, we all follow this like very effective formula. Um, which is like background, aims, method, results, conclusion. And this is like, it's a little bit different. It's an evaluation project, it's a different research theory, which I'll talk about, but just like bear with me because the flow is a little bit different than what we might be used to. But with that said, I will start off, with the background, but the background's going to cover not only like what we're trying to do and why we're trying to do that, but also give you a lot of partner information. Then I'm going to talk about the evaluation plan. I'm going to go through results with you guys, and then I'll end with discussion and next steps for first steps. Um, and this is where I feel like everyone in this room kind of knows, right? Opioid-related overdose is one of the leading causes of maternal mortality during the peripartum window. And while overdose has historically affected white perinatal populations at higher rates, the gap is closing, and Black birthing people now face a double burden of rapidly rising overdose mortality alongside their historically higher risk of birthing complications, largely due to systemic racism and factors associated with that. So community-based participatory research, also known as CBPR, which I'll probably refer to it as in the presentation, is a framework for study design and implementation that prioritizes involving diverse stakeholders, including community members affected by the research problem, even though it's not maybe the best way of saying it, throughout the research cycle. So typically when we think about research, well, when I think about research, I think about like the ivory tower, a white lab coat, right? Like a microscope, and we're looking at the thing that we want to study. We're not the thing that we want to study. And CBPR really posits that like research is so much more effective and equitable when we have people in the room who have lived experience with the thing that we're studying. And that's part of the foundation of it. And that's part of the foundation of this project. And it's not just like a theory without evidence. CBPR really is effective at reducing health disparities and it increases research engagement in communities that have historically been harmed or underrepresented in intervention studies. And so First Steps Partnership, the overarching goal, the long-term goal of this partnership, is a community-based participatory research project that aims to create and ultimately test a peer support-based intervention for pregnant and postpartum individuals with substance use disorder to help reduce maternal morbidity and mortality. That's like the long-term goal. So to meet this long-term goal, we have started on this like partnership journey, right? Where Caitlin and other community partners have started connecting with one another to take the first steps toward creating a team of people that are best equipped to kind of encounter this health disparity problem. So our partnership is made up of community leaders in the peer recovery support space. We got community experts in culturally appropriate maternal and child health support services. We have researchers and scientists from the academic community that have substance use disorder, methodological, and peripartum health expertise. We have a social worker, and we also have research and administrative support staff that have identities shared by the intervention's target population. And I want to do a little bit more in depth for each partner because that really is like, I cannot stress enough how important the partnership part of this project is. So I want to introduce to you all. Also, like I see a lot of the people here are very like CBTIO, so this might be like rather new to you. So I do think I'm like excited to be like, yeah, this is what we've been working on Thursday mornings. So the first partner I'll introduce is Rams in Recovery, which is VCU's collegiate recovery program. We have two members of Rams leadership that are First Steps partners. They're both in long-term recovery and work as peer recovery support specialists. And they have really just, I think, enhanced everyone in the partnership's understanding about how to provide compassionate recovery-oriented care to people with substance use disorder. We've also been lucky enough to work with Urban Baby Beginnings, which is a maternal health hub system that provides care coordination, social support, and baby essentials to pregnant and parenting families through perinatal health hubs and satellite offices. Let me see. I'll look at the chat in a little bit. Sorry, I got distracted. So as a First Steps partner, the CEO of Urban Baby Beginnings brings expertise in doulaship, public health, and nursing. So Urban Baby Beginnings has really, similar to how Rams in Recovery has helped us kind of understand how to be better interventionists and scientists in regards to substance use disorder. Urban Baby Beginnings has really helped us understand how to deliver compassionate, culturally tailored care for Black birthing people. And then we have OB Motivate, which most of you guys are familiar with. In particular, we're working with the social worker at OB Motivate who has just a ton of experience working with people who are pregnant and parenting with substance use disorder. So she has just been like a wealth of knowledge about like the systems that these folks often interact with, like child protective services, the justice system. But she also just like knows like if there's a resource, she knows about it and has been really helpful in, I think, like uh, helping us fine tune how we can help and what's already out there. And then finally, we have researchers and let me see, I want to go back. Researchers and Ivy Lab people. So we have a lot of great scientists. Like I said before, we have substance use experts, peripartum health people. We have people who, you know, their whole careers have been built around doing clinical trials. And we also have a cost analysis expert to help us like scale up one day. And then finally, we have us, Ivy Lab staff and student members. So these people have helped like organize the meetings. They've kind of done the like back of house stuff and also taken a large part of the labor around intervention development. And then we have Dr. Martin, who has also helped with all of those things in addition to kind of like taking the lead on funding and grant submission. And this Ivy Lab team also made up this partnership evaluation, which is what I'm going to be focusing on now. So successful community partnerships have been found. This is okay, have been found to have more success addressing social health disparities. And when I say successful, I don't mean like they're successful because they're successful meeting their aims. I mean successful like they share certain traits, like they share power, they trust one another, there's equity in the partnership. So partnerships that have these certain traits are more capable at lasting a long time and helping more people. And we also know that evaluating partnership dynamics can help strengthen these partnerships. But unfortunately, the tools that we've been using have either been underutilized, so people are not evaluating their partnerships, or they're kind of using one tool here and another tool here, and all of these tools are often not validated. But recently, so this is like pretty new in the CVPR field, experts created a validated tool called the Measurement Approaches to Partnership Success, or MAPS. And so the primary aim of this phase of first steps was to establish a strong partnership, and to help facilitate that as well as help evaluate it, we use the MAPS toolkit to evaluate partnership dynamics so we could understand, our strengths, areas of growth, and capture any changes over time. So let me check the time. All right, we're good. To briefly recap that, over long-term goal for first steps is to improve the health outcomes for pregnant and parenting individuals with substance use disorder, particularly related to the opioid overdose crisis. Okay. In order to do that, we're looking at this first phase of the study, which was all about building a partnership. And so the partnership was created or developed in two phases, basically. So we're a reverse classroom phase where we each took turns as partners teaching one another about our expertise, and then in the intervention adaptation session phase of the relationship development part of first steps. And I'm going to show you the slide, and it's not as scary as it looks. You don't need to read the small words, but I just want to get, this is like the study recruitment and procedures. So you have June to September of 2024, we're setting stuff up, hiring, you know, planning this evaluation. And then in September, we start. We have our first reverse classroom session, which is I was trying to know what colors these were. I feel like this was periwinkle, maybe. But we have our first classroom session, and these little nodules are the rest of the sessions. And then we have our first partnership survey sent out soon after that. So this is not teal. I think it maybe is aquamarine. We have our first survey sent out about partnership dynamics. We analyze that survey here, and then we share the survey findings from baseline with our partners in March. Very soon after, we ask partners to give us even more feedback about the evaluation results to see if there's something else we need to do or know. And then that marks kind of also this next phase in relationship building, the intervention development phase. And here you can see the red is this second partnership survey. So today I'm going to be focusing on this and this. And I'll show you another, I feel like when I see slides like this, I'm always but I'll walk us through it. And I think it'll be pretty comprehensible. So first, the surveys were sent out via RedCap. We sent them to partners who completed them anonymously. And this table has the domains and measures that were included on the survey. So first survey, November 2024, second survey, June 2025. Yellow denotes qualitative. So each survey had qualitative components, and blue denotes quantitative. The surveys also had quantitative components. So these labels like process, reciprocity, competence enhancement, equity scale, synergy scale, these are all of the domains that the people who created MAPS had captured as being important to partnership success. And then the open-ended questions, the qualitative questions, reflected these domains. And so for analysis, we did, for the qualitative part, directed thematic analysis, where 3 different coders independently coded the answers. And then we met to discuss themes. We would reach agreement. I feel like the older I get, the sooner my voice stops working. like a weird aging thing that no one told me about. But anyway, we met, we talked, we reached kind of consensus about what we thought partners were saying about the partnership. For the quantitative piece, we did descriptive statistics. So we really looked at averages for the scales, and then we shared that with the partnership after we had kind of figured out the averages for each subscale. And then at the second time point, we did the same thing, and we also added paired t-tests to see if there were changes from the first and second time point. So for a brief overview of results, the qualitative evaluation results were encouraging. Stakeholders reported positive experiences with the partnership. Partners shared some concerns about partner dynamics and told us that there were certain areas that we could do better. And then while quantitative findings generally suggested growth, and I'll get more into detail with that, like each scale, we did better at the second time point. The threshold for significance was not met. We think this is probably because the sample was pretty small. It was like 11 the first time and 8 the second. So I walked away from the analysis and the results feeling like pretty positive about what the evaluation was saying about the partnership. And so just quickly to go through some of the themes from the time point one are the green boxes. So people told us that the partnership was new. They were like, okay, relax. Like we don't know each other well that right now we can't really tell you if it's good or not. But overall, people told us that they had like a positive perspective on what we could do together. They also did say that there could be more collaboration between community partners and academics, especially regarding leadership. At time point two, we were yet again reminded that we were still a new partnership. Um, Partners said that we were collaborating successfully, that they felt that there was space for open and honest communication. People liked the evaluation. They thought it was feasible. And also, this one was interesting. Like most partners shared that they really valued the face-to-face time that we spent together, whether it was saying like it was so good or wishing that we could see one another in person more. And they also suggested that we give partners more time to shine. For the scales, so this is how the maps, like folks want us to present the findings. And I do think it's pretty interesting and helpful. So it's a little bit different than like, how a table would look, but this is how all of this scale, I'll present all of the scales to you guys. So the first scale was the precursor to partnership success scale. And the responses that partners could endorse were here. You can see 1, disagree to 5, agree. So the closer to agree, kind of the better. And at survey 1, the average score was 4.22, which is pretty good for starting. And then it improved to 4.77 at time point 2. For the reciprocity scale, which captured if partners thought that there was a mutual exchange of knowledge, resources, and opportunities, we had a pretty high starting score at 4.83, which did improve slightly to 4.9. For the competence enhancement scale, we had, so this was saying, together we enhance one another's skills and knowledge, and we leverage power and resources. And we started at 4.39 and ended at 4.64. The equity scale, which measured 2 dimensions of equity, relational equity and structural equity, started at 4.33 and ended at 4.85. The synergy scale, which is really saying like together we are better capable of accomplishing what we want to with first steps than alone, went from 4.55 to 4.98. And so one of the things that I thought was like unique about this and really cool in, coming from like a largely research background is that we got to share these findings with community members and partners like immediately. So it wasn't like this delayed thing. Like I feel like sometimes we talk about like, oh, this is associated with this and it's a small effect size. Like, and that's important. And, I understand how that can be meaningful, but we got to say like, oh, people told us that we could do better at this. How can we do better at this? And see in real time the way that the evaluation was able to open up space for discussion and also just like give us things to think about. And I think in research, I haven't gotten to do that yet. And it was really cool to be able to have like a almost like instant gratification with findings. And so how we kind of applied what we found when partners told us they wanted more leadership. We tried to open up reverse classroom sessions to have partners lead. So whether that was, handing over like scheduling reins or Zoom links or, asking what that looked like, we made that effort. And another conversation that we had throughout our time building this partnership, and we just kept returning to it and allowing one another to like kind of experience frustration, but also understanding was this issue of like um, prioritizing productivity over relationship building. We had milestones to meet and deadlines to create this intervention. And sometimes both community and academic partners voiced that they felt that the deadlines and the milestones were being prioritized over the partnership. And we tried to, I think, approach this by opening space for a discussion around that to talk about what that experience was like, to see if there were changes that we could make that would kind of reduce that burden and that feeling. Um, and I think a lot of those discussions, even if the solutions were imperfect, the effort to connect and work together to solve them was like a nice balm to the problem, if that makes sense. Um, and I think one of the big takeaways for me is, as someone who's like not done a lot of like partner evaluation, is that the MAPS tool I thought was really helpful in strengthening group dynamics and structuring this evaluation. So for us, for next steps, the partnership is finalizing an intervention and moving to like testing phase, which is really exciting. We also will continue to have like the evaluation process. We'll have another evaluation time point at the end of the pilot study. And we'll continue to try to like carry on those CBPR values of making sure that we incorporate partners and community members with shared identities across the research process. Okay. And thank you to our community partners, our staff, and to the recovery community who has done so many rounds of like feedback on this intervention. They've been so lovely and so helpful. And these are my very, very small references. Okay. I can stop sharing. Great.
Thanks. Thanks, Nicole. That was great. It was really nice to see it all in a presentation after seeing the evaluation. I've read the paper many times, so I'll open it up to any questions people have or points of clarification.
I have a minor one. We received, I think it was a manuscript maybe like 3 months ago. This is the one you're publishing, correct?
Yes.
Oh, yay, that's exciting.
Mm.
I have a question, just like looking forward to the next steps of this project. As you move into kind of the intervention phase, how do you anticipate still cultivating this relationship building with all the community partners and stuff? What is that relationship going to look like once the intervention is made? Or have you guys thought about that yet?
That's a good question. I think that we have thought about it. I think part of it will be just like continuously getting that feedback about like, are we feeling connected? I also think that one of the interesting things about this partnership, and I can only really speak to myself, is that like, I'm also in REMS in recovery, right? So like I have a dual relationship with partners. So in some ways, that's the goal also. Like we want that to happen in a partnership. We want our members to kind of like become part of one another's groups. So I think that's partly happening. We're having this like really beautiful natural crossover. But you're right in that I think this next phase, you're just like bringing up a wonderful point, which is that like we should go into this with intentionality. And I think that's something that I'll bring to like the next research discussion meeting.
I had something to add. Also with the term of moving and having next steps, are you guys interested in moving beyond just like this practice area, like Richmond, Virginia? What other ways are you guys going to kind of branch out?
Yeah, I think so. I think that, um, you know, not to be like recovery coded, but like one step at a time. But I think it'll be like, yeah, I think it'll, we'll see how the clinical trial goes. But the idea of having someone on board that does like cost analysis, and a lot of what Rams in Recovery has been talking about for us is like how to make this um, billable for health insurances, and also like scalable in terms of how do we train peers to do this and provide this service, not just in Richmond.
Right.
Yeah, that I think it's just like first off, great job, and I enjoyed reading the paper, and I feel like I had a lot less like edits or comments than I would normally would on like a paper that's like about us, but not, I don't know. So that just I think is a reflection of the quality of the project. And I think that's been an interesting thing for me, like as a partner to navigate, where I do have like a little bit of a foot in the research, but much more in the kind of like practice. There has been this tension between, okay, we need this RCT for the cleaner, uh, medically accepted science part of things, with also this like, hey, there's a bunch of folks that are working in these positions that don't know what they're doing, and we could really help them do what their current roles are a lot better, more immediately. And that kind of tension is, I mean, I think it's like a helpful tension because it makes sense, and it's helped to like for me to kind of see that perspective in terms of like more national change and kind of broader impact beyond just our community. But it's also, there's also this like push within the group to say like we can make a difference in some areas and some practices of the folks around us, without taking forever. So
Yeah, I think sometimes like when you were talking, I'm thinking like it's easy to forget when I'm looking at this as a research problem that like by us taking a long time, like people die. Like that's, like these are our friends and our family and our community members. And like that's why it can feel so, or it is so important to kind of like, I understand the urgency. Like I know why it's there, and I feel it as well. It's like we could be helping now, but it's also the like, okay, we're going to take these steps and see if we can like build something together, even though I agree there's like frustrations with the process of research too. Also, I'll add, you got the paper, Tom, like after it had gone through like maybe 5 rounds of edits. So like it was largely not a first draft sent to you. Is that all?
Yeah, I think so, Nicole. You and I literally just met right before this. So we already talked a lot about this, but it's really exciting to be able to have some results just from all the work that we've been doing together, and being able to see that in a kind of a different way of showing the same thing, that we get to see in our relationship building, number one, but then be able to have the numbers is always really great to just be able to see it and reflect and on our successes in a different way. So I appreciate you doing all this. And like I would just make a comment like to Madison's question earlier about like moving forward into the intervention in the clinical trial. Well, we will see, and we will keep Nicole, we'll keep evaluating how we continue to move the CBPR principles forward. And it'll be a new experience for all of us doing a clinical trial and trying to meld what Tom was saying, like the rigors that we typically deal with over there with the CBPR principles. But we will figure it out. I know one thing it will do, kind of speaking in the words of what some of us who do clinical trials right now do. Right now, for medication clinical trials, it's normal to have like a DSMB, a data safety monitoring board, who oversees your trial. It's, you have to report to them at least once a year, and they give you input and sign off on a lot of things. And so we do plan on having our partners continue to be like a really amazing version of that. And so continue to be kind of, I don't know, we'll figure out a cooler way of saying like an advisory board or advisory group or project leader group. We'll figure out a better term. Well, Nicole will, of how we'll name it, but that's what we're writing into the grant that we're submitting next month, to go to the next phase. And so we plan on that being one aspect of how we're moving CBPR into. Now we're actually doing the trial by having the partners at all the decisions, just like a DSMB is in the quote normal clinical trial world. Great. Well, awesome job, Nicole. And thank you everyone for coming. And we'll see everyone next month for our next lab meeting.
Bye. Stay warm.
Yes, please.